So just expanding on that and broadening out a little bit more. Even though the nose has the association with the lung channel, with the lung, channel pathways here are more diverse than that. So, for example, the lung channel doesn't go to the nose. The Yang-Ming channels, classically left in this area, large intestine and stomach, travel to here. You've got the Tai-Yang channels, bladder and small intestine, which reach the nose and the surrounding area. So there seems to be some crossover for Yang-Ming, but not necessarily the classic signs and symptoms. And Tai-Yang associates with headaches, but I felt Yang-Ming was stronger here due to the actual physical location of the pain around the stomach channel. So jaw pain, again, strong fixed pain, sinus blood stasis, local area points along the stomach channel, and there could be kidney deficiency due to jawbone pain itself. Low back pain, kidney deficiency, could be blood stasis there, and also pain travel up the side to the liver area. And you could associate an exterior wind attack to that kind of pain along the shoulders as well. Eczema, damp heat, wind heat, and there's red lesions, they're itchy, seen as wind involvement, and the chin jaw area is the stomach channel area again, so there's a bit of stomach channel crossover. Okay. So basically, for the conclusion of the diagnosis, I went for a Yang-Ming channel blood and qi stagnation, with liver qi stagnation and an underlying kidney yin deficiency. Alright, so these are the acupuncture points I used. So this will give you an idea of what's going on. This is the patient. This is bladder 1, stomach 6, stomach 7, small intestine 18, gallbladder 14 on the right hand side, and large intestine 4 both sides, which is good for lower jaw pain associated with stomach 6. So this point here is bladder 1, just the needle was flopping over. So this gives you an idea. And also I used back shoe points as well, 18, bladder 18, 20 and 23. Okay, so the patient felt dirty at most points. The face is quite sensitive, so I can imagine so. Sinus headaches were still happening, but not as strong, so there's a reduction in pain. The lower jaw pain improved right after treatment and a few days later, and the lower back pain was still prominent, and she woke up at night with pain to the needle area that following night, or the night of the treatment, sorry. And her anxiety and stress was still prominent, but she's under stressful exam conditions. So with treatment 2, again we used some similar points. I'll just show you some pictures too. But we added triple energizer 17 for swelling in the face and pain. I put liver 3 in, stomach 44 as well to reduce heat in the stomach. And I used bladder 40 instead of bladder 23 to reduce the pain that she experienced when she woke up at night with that. And I used electro on stomach 6 and stomach 7 on both sides. So she's not smiling because current going through. And also I added 5-minute back massage to alleviate any stress as well. So there was pain relief with the sinus headaches for the last week we did it, which was good. Jaw pain improved right after the treatment and a few days later as before. The patient decided to come in twice a week to maintain pain relief. The lower back pain was still prominent, but only when sitting down. So her anxiety and stress felt a little bit more under control, and eczema it moved from being on the jaw to just being under the inside nasal region. She felt she was getting some progress there. And her attitude was more elevated and positive as well. So, just on reflection, the face is a really sensitive area to needle. Definitely gained a lot more confidence and ability here. For example, I started off with my first treatment, I did bladder 1. That's the first face treatment. But that was a bit tense, and I decided to use other face points and then go to bladder 1 as the last point later on. I tried to use root and branch theories here. I don't know if anybody can remember those, but I went for the idea of treating the back tube points to support the body, and then I did the local pain areas in the face mostly. So basically I was doing two treatments for this and juggled time, patient positioning, I got a lot better. And I thought, like, on reflection I should explore damp issues more for the sinus, because we have polyps forming there in the sinus, and maybe added stomach 40 and stomach 38 to help with that. And also she had facial swelling in the mornings when she woke up, so that might have helped with decreasing damp as well. So anyway, overall I achieved some nice pain relief for sinus and jaw pain for the individual. Some references, and